Then we were on the front line. We were seeing the struggling. We were seeing the suffering. We were seeing the people losing their breath and dying. We were sending thousands of patients to the hospital. 9 of each 10 died. That was difficult. It was difficult not to have a country prepared with PPEs, not to be prepared with testing in any direction.
Dr. Ramon Tallaj is the founder and chairman of SOMOS, a network of healthcare providers serving disadvantaged communities in New York City. He and his team have battled the coronavirus since the start of the pandemic.
At that time, somebody said to me, "Oh, look at what happened in Italy. It's not going to happen here." I said, "What are you talking about? That was coming to us. We need to be prepared." And we're talking about February. That's when we start preparing for this. My partner, Dr. Henry Cheng, is from China, and his group. We look what happened in the whole Asia area. And we start preparing to have PPEs, buying whatever we could find it to do the test. Also, we instruct to have telemedicine for all of our practices. We're talking about the beginning of March. Some people were saying even don't use masks. We knew this virus, the SARS, is coming in the air from the beginning. We didn't wait for the authorities to say, you must use masks. Just the inequality was there. From the beginning, it was clear that this virus was affecting more the people who were essential workers because they had to continue working. Then the first testing site that we did in Queens showed up 70% positive. But those people were coming back to their houses, to their apartments, small, where family lived 3 generations. What's going to happen? People are going to die. 3 generations of people who are not well treated, don't have enough resources, plus a lot of people without documents that need to continue working, otherwise they could not live. That mix was a nice soup for the virus to go there and kill people. And that's what happened. We asked for isolation places, hotels, gyms, schools, to put beds and put everybody together there. All the positive people should be there. It didn't happen. Nobody recognized the hotspot but us. The authorities who were supposed to go and track and trace were hiding. They were afraid and they didn't hear what we were saying. That's why so many people died. Because we ourselves brought the virus to our building.
For Dr. Tallaj, it was time to make important decisions.
March 26, already almost 20 days inside that battle with the virus. The first testing site was the 15th. We knew it was a nightmare. First, we started to pray every day at 8 o'clock. Yes, we were afraid. We were more afraid not to say lies. Action, even in the higher cost, was the way we decided to confront this virus from the beginning. And that's why so many people died in our group.
He does not forget the physicians who died serving the community.
It's Dr. Deku, one of my board members, called me, his wife, telling me he's gone to the ICU, he's gone to the hospital. So let me talk to him. He actually was able to even say to me, he wasn't able to talk. That's the last time I talked to him.
Dr. Tallaj pulled all of SOMOS' resources to fight against COVID-19.
We ourselves put 23 million of our own resources on the spot from the beginning to buy PPE, to buy the minimum, the place where to test, like this beautiful place to do vaccination. We create centers to do testing inside through the city. But we also ask for isolation. We create pamphlets. We had 1833 SOMOS NY to give information to people. To the people without insurance, people without papers, for anybody. We had 3 different languages answering to anybody who wanted to know what's going on. Because we knew this virus was going to be lethal, especially for our people. We haven't been getting any money back from that money we spent, but we don't care.
SOMOS has vaccinated thousands of disadvantaged individuals, especially Hispanics, Asians, and African Americans. Ramon Tallaj created the SOMOS network of healthcare providers in 2015. Back then, he believed this initiative was necessary. Now, he is convinced that SOMOS is essential for America.
I started SOMOS because I saw the need to change healthcare in America, in our neighborhoods. How come healthcare will be based on buildings? No. The human life and all their needs in their communities is important. That's what we call value-based quality, value-based payment. It's not a transaction because I need money to pay payrolls. Yes, we need those buildings, but we need to save the community. This is why SOMOS has so much reserve on money to put it into the game when this pandemic hit. We were prepared to buy PPEs, to buy tests, to give food, to take care of the needs of the community as a whole.
The presence of God is the backbone in his life.
I pray every day. I understand the importance of the prayer is because you have to remember every day who you are. Just to remember myself, that I'm nobody. He's in charge. He's the one who decides, and nobody else.
Almost 2 years after the pandemic hit, Dr. Tallaj is a changed person.
We need to use all the resources that we have for what the mission is. Take care of the poor, feed the hungry, take care of the sick, and the goods of the others, and trying to gain more doing the thing that the Lord wants us to do.